I'm Dr. Patil. I'm a primary care physician and I see all ages, starting from newborn to elderly patients. So patients often struggle when they should see their primary care provider. There is no set rule that patients should see their primary care provider every so often. It really changes with how healthy a person is, how old the person is, and how much understanding they have about their own medical condition. I think the patient's smile when they enter the room tells me a lot about how they felt about their previous visit when they left. So the first visit with a patient can be often overwhelming, sometimes for the patients and for the physicians, because patients have a lot to share and a physician wants to know a lot about the patient. I often will let my patients know that knowing this is a first visit, we should probably focus a lot on your health, the previous health issues, current health problems, and what we're trying to achieve in this visit and setting some goals. So once we're able to understand what the real problem was not to be able to control their health, then we start setting small goals. I do not consider not achieving goals as a failure. And sometimes we go 2 steps forward, 1 step backwards, and that's okay. It's life. But not to give up on your goals or your dreams is the most important thing. When I see my patients take control of their health, it is very rewarding to me. I am like a mirror. If my patients are happy, if they're smiling, it brings a smile to my face. If they're sad, it brings 2 tears to my eyes. If the tears are of joy, I will shed tears of joy with them. The easiest thing that I do in this office is writing prescription and sending out the referrals. The hardest thing is to look into my patients' eyes and tell them what they're not prepared to hear, but still feel cared for at the end of the visit.